Zoonotic infections. Zoonosis are diseases transmitted to humans by animals whose primary source of infection is bacterial, viral, or parasitic, and can also be caused by non-traditional agents such as prion. The World Health Organization estimates that 61% of human diseases are caused by animals. Zoonotic diseases account for a large proportion of all infectious diseases and are considered the most dangerous. This is because the main cause of the condition can mutate in the human body, resulting in new and very severe diseases. The most recent example is the emerging coronavirus, whose main source is the bat, and which, contrary to popular belief, does not cause diseases in that animal, but causes a global crisis once it enters the human body. Significant zoonotic diseases. Because there are so many diseases of animal origin, it is impossible to list them all. However, the most common ones are as follows. 1. Swine flu. This is the name given to a collection of respiratory disorders that people get after contracting influenza from one of the animals. The following are the most common forms of influenza that have spread in recent years. Bird flu. Swine influenza. 2. Malaria. Malaria is a parasite disease spread by mosquito bites that causes chills and a high body temperature in humans. In most nations, this disease has been eradicated to a large extent, but there are still countries that suffer tremendously from it, with 290 individuals affected per year. 3. Parrot mania. The bacteria Chlamydia psittaci causes parrot fever, also known as bird sickness. Bird species, particularly parrotfish, spread the sickness. 4. Rabies. Rabies is a disease transmitted to people by a virus found in the saliva of an infected animal, and infection is almost always the result of being bitten. Although the disease's name suggests that it is caused by dogs, it is actually caused by a range of other species, including foxes, bats, and raccoons. 5. Plague. One of the diseases that has spread widely and killed many people is plague. It is a sickness caused by the bacterium Entrobacteria Yersinia, Pasteurella pestis, and spread by mice to humans. 6. Mad cows. This disease is strange in that it affects humans in a variety of ways, one of which is eating beef that includes prion. It is important to note that prion is a sort of protein that causes an imbalance in the body's proteins and causes many divisions, causing damage to the body. Nervous system cells. 7. Other ailments. The following diseases were also present: anthrax, Ebola, tick-borne encephalitis, abortion with nitrogen, the erysipelas. Giardiasis is a parasitic infection. The glanders. Colitis hemorrhagic. Leptospirosis is a disease caused by bacteria. Infection with listeriosis. Lyme disease is a bacterial infection. Chorioamnionitis lymphocytic. A tooth infection. The illness Pasteur. Q fever. Rabies. The rat flu. Ringworm is a fungal infection. Spotted fever of the Rocky Mountains. Infection with salmonella. Infection with E. coli. Rot caused by streptococcal bacteria. Toxic illness. Tuberculosis in cattle. Brucellosis is a kind of brucellosis. Infection with Campylobacter. Fever caused by cat scratching. Mysterious spores. Cysticercosis is a parasitic infection. Dengue fever is a mosquito-borne disease. Toxoplasmosis is a parasitic infection. Trichomoniasis is a parasitic infection. Tularemia is a disease that affects people. Diphtheria zoonotic. Zoonotic disease symptoms. Because it is impossible to define particular symptoms for all zoonotic diseases because each disease has its unique set of symptoms, the following are generic symptoms associated with the most common zoonotic diseases. a rise in body temperature. Coughing, shortness of breath, stuffy nose, and increased nasal secretions in the case of respiratory disorders in animals. In the event of exposure to zoonotic diseases transmitted via mosquito or tick bite, skin patches, discoloration, itching, and peeling may occur. When exposed to a digestive illness, such as E. coli or salmonella, the digestive tract might become messed up and cause stomach pain. Mental disorders such as delirium, difficulty speaking, and loss of attention in animals suffering from nervous system ailments. Zoonotic disease causes and risk factors. Let us study about the causes of zoonotic diseases and the variables that raise the risk of these diseases in the following sections. The origin of zoonotic illnesses. The fundamental source of zoonotic disease infection is the entry of pathogens such as viruses, bacteria, fungus, or parasites into the human body, which can happen in a variety of ways, as shown below. Close encounters with animals. Direct animal contact can mean one of the following. 1. Taking care of the animal's body. 2. Handling animal waste, such as urine, feces, or mucus, which occurs frequently when cleaning animals. 3. Working with animal blood, particularly after it has been exposed to a wound. 4. Being bitten or scratched by an animal. Nonverbal communication. The disease is spread from animal to human via one of the following routes. 1. Contact with mosquitoes carrying the pollutant carried by one of the animals. 2. Swimming in disease-carrying fish-infested water. 3. Cleaning coops for chickens and cows, as well as bird cages and other items. 2. Factors that make zoonosis more likely. The following were the factors. Body immunity. Whenever the body's immunity is compromised for any cause, the risk of these diseases increases dramatically. Age. Most zoonotic illnesses disproportionately harm children and the elderly. Residence. Endemic areas are full of illnesses that are sometimes uncontrollable due to the spread of disease vectors such as mosquitoes. The type of food consumed. People who eat raw animal meat are more susceptible to these diseases. Zoonotic disease complications. Complications can be mild or severe, and the type of disease determines this. It can be said that serious diseases have the most terrifying multiplier for them, which is death, because death frequently occurs at the start of the emergence of new zoonotic diseases, and they eventually become normal diseases as medicine develops treatments or vaccines. Zoonotic disease diagnosis. The following tests are used to diagnose various zoonotic illnesses, the most important of which are: physical examination. Number 1. Before beginning any laboratory tests, the doctor will do a clinical examination of the patient and ask him numerous questions. Because there are so many disorders, he may limit the amount of laboratory tests performed. After determining the ailment, the doctor runs laboratory testing to determine the cause of the symptoms. 2. Laboratory analysis. The laboratory tests are determined by the doctor, and none of them can be determined without a doctor's examination. Typical laboratory tests include a complete blood test, stool examination, examination of the urine. Antibodies in the blood are tested for certain types of causes. Photogrammetry is the third step. The following are the most important imaging tests: radiography, CT scan, computed tomography. MRI stands for magnetic resonance imaging. When serious symptoms emerge on the respiratory system, digestive system, or nerve cells, this diagnosis is made. Zoonotic illness treatment. Treatment is determined by the type of zoonotic disease, and each disease is treated differently. Zoonotic illness prevention. The following guidelines can help to prevent zoonotic diseases. Using accessible zoonotic disease immunizations and not underestimating their effectiveness. After handling animals, wash your hands thoroughly. Before washing, make sure your hands do not touch your lips, eyes, or any other sensitive parts of your body. Mosquitoes and ticks are the most prevalent vectors of zoonotic illnesses and are controlled by spraying pesticides, applying protective creams, and wearing mosquito nets. Avoid all types of meat, whether raw or semi-cooked. Avoid inhaling dust-containing animal feces, which should be handled with caution with a mask and gloves. Vaccinating domestic pets on their own. Wash fruits and vegetables well before eating them, as they may be contaminated with disease-causing contaminants from animal droppings. Make sure the drinking water is safe and free of animal waste. When dealing with animal wounds, wear protective and hygienic gear.